Good afternoon or good morning, everyone. We would like to welcome you all to our webinar, Oasis E, New Questions and New Functionality. Our goal is to help all of our agencies succeed with the upcoming Oasis changes effective January 1st, 2023. And we would like to present how the new questions will be displayed in Alora, as well as the improvements and new functionality being introduced along with the new Oasis assessment. My name is Terrence Finesse, and I am the Customer Success Manager at Alora. And I've been with Alora for almost 7 years and working in the home health industry for over 20. I want to welcome everyone to this session today and thank you all for taking the time out of your busy schedules to join us. I know that many of you have been anxiously waiting for this presentation. Some rules of the road. If you have any questions as we go along, you will be able to type at any time in the side panel, which you should see just to the right of your screen. We are going to mute everyone during the presentation to keep things moving, and we will answer as many questions as we can at the end. If we don't have time to answer, we can send a response to you through email. We do ask that your questions are related to the Oasis E and its functionality in Alora. And no worries if you miss anything during the webinar, we are recording it and we'll make the video available to you within a few days. I will be presenting the live demo in Alora later on and helping to answer any questions at the end. We also have Andrea Rape, Alora's Solutions Advocate, to help answer some clinical questions during the Q&A. Do you want to say hi, Andrea?
Hello, everybody. I'm glad to be with you all today during the webinar.
Thanks for joining us. So now I'd like to introduce our main speaker today. We have Alora's Vice President of Operations, Colleen Jones. Are you ready to get started, Colleen?
Yes, I am. Thank you all for coming. My name again is Colleen Jones. If you've attended our past webinars, you may recognize my voice. I've been with Alora since 2009, and I've worked in the home health industry for more years than I want to admit here in this webinar. I was present when the first Oasis came out, so that probably gives you some indication. And I've seen the evolution over the years to what we have before us today. Over the last 14 years, I've worked with the Alora team to meet these changes and to share the information with our users. We are glad you've joined us today to better understand the changes and how Alora will handle them in the software. So let's get started. During the webinar, we will be presenting the following information. Information on the new Oasis format, the new Oasis questions with a focus around the BIMS and the CAM items, questions that have been removed or replaced with the transition from Oasis D1 to E, items removed from the follow-up assessment. I know you all are excited about that. We will have a live demo of the Alora improved functionality in Oasis E that Terrence will present as he is shared, and some Alora Phase 2 items that we will be sharing with you as well. On the old original Oasis, the questions all started with the letter M followed by zeros and numbers. Because of the M000, the slang that was initiated was moo questions that we all referred to, and we sometimes still do refer to them as moo questions. But it has evolved in the past Oasis updates, but none so much as it has in the Oasis E. The new Oasis E format is divided in sections A through Q. With that in mind, we've kind of chuckled a bit about what we're going to call those questions. If they're going to be boo questions, do questions, goo questions, we will try to refrain from that and just refer to the Oasis question C1310, for example. Let's review the new format. There are 27 new Oasis questions in the Oasis E. 5 questions have been removed and 4 are replaced, and we'll go into detail about that in a few moments with a different slide. We want to review the new questions and what alphabetic category they are in on the Oasis E. These categories are based on the Oasis E, not the Alora categories, and we'll touch on that a little bit later as well. There are 9 questions in Section A, the administrative use. There are 3 new questions in Section B around hearing, speech, and vision. There are 6 new questions in Section C, cognitive patterns. There are 3 questions in section D for mood. There are 3 questions in section J, health conditions. 1 new question in section K, swallowing and nutritional status. 1 new question in section N, medications. And 1 question in section O, special treatments. Alora has continued with our body systems approach and have placed the questions accordingly to the comprehensive assessment. We expect that this will continue to provide a solid workflow and allow the clinicians to identify where a particular question resides. Let's show you where these items can be found in Alora. Section A of the Oasis E is the patient tracking and history and diagnosis area of Alora. The start of care only will have some enhanced elements around ethnicity, race, and language. You'll have some elements there that we've not had before, and some additional options where you can check multiple, and Terrence will illustrate that a bit. The start of care, resumption of care, and discharge will include A1250 transportation. Section A also has an item that Alora includes in the medication section of the assessment. On the transfer assessment, A2121 and A2122 is looking for the provision of a current reconciled medication list to be sent to the subsequent provider and what method they're using to send that information. On the discharge, there are added items A2123 and A2124, which is related to the medication being provided to the patient and the method in which it will be provided. Section B is found in sensory in Alora. On the start of care only, we have B0200, hearing. This is assessing the patient with hearing aid or appliances if regularly used by the patient. I have trouble with speech on that one. And B1000, vision. That's the ability to see in adequate light with glasses or other visual appliance if that is regularly used by the patient. Regularly is hard to say. But on the start of care, resumption of care, and discharge, we have B1300, health literacy. This is used to determine the amount of help needed to understand the documentation provided in pamphlets, instructions, or other written materials provided by their physician or pharmacy. Section C items will be found in the neuro-emotional section of Alora. The buzzword for Oasis E is BIMS. You will hear it used and referred to frequently, as this section is determined to provide insight on the patient's current mental status by performing a brief interview of mental status, otherwise known as BIMS. C0100 and C0500, is referencing the specific interview questions needed to perform this assessment and will be completed on start of care, resumption of care, and at discharge. Also included in this section is C1310, signs and symptoms of delirium. As the BIMS section is new, it's important to explain that there are good guidance materials available to your agency and your clinicians. It is important to understand whether or not the BIMS should be completed, and CMS has set some particular expectations for this interview. First, the client should be spoken to in their preferred language, making sure the client can hear and has access to their preferred method for communication. The clinician should offer alternative communication methods if needed. Examples would be writing, pointing, sign language, or cue cards. We have provided some general definitions that may be needed for the BIMS assessment. The nonsensical response. The patient may provide nonsensical answers. This would be representative of any response that is unrelated, is incomprehensible, or incoherent to the question. It is not informative to the question at hand. Another term is complete interview. The BIMS interview is considered complete if the patient attempted and provided relevant answers to at least 4 of the questions included in C0200 through C0400C. Relevant answers do not have to be correct, but do need to be related to the question. I know this part can be confusing, so I think the next slide may help in understanding this better. For the purpose of the OASIS response scoring, an incorrect answer, which is scored as 0, could be incorrect for the following reasons. It could be incorrect because the response was made, but the wrong answer was given. The response was given, but did not make any sense in line with the question at hand. Or the patient gave no response, refused to respond, or the response deflected the question at hand. For example, you know what day it is, you don't need me to tell you that. The nonsensical question response is there as well. I didn't actually read that or state that, but the response given where it is not in line with the question would be the nonsensical. We're going to jump ahead to the C0500 to help illustrate what Alora is doing to handle the scoring of the BIMS in respect of the previous mentioned options. On the Oasis E document, there is no solution for the clinician to keep track of nonsensical or refused responses because all of these fall under incorrect response, 0 score. But the guidelines indicate that if 4 of the questions have been responded to with nonsensical and or no answer, then interviews should be stopped. In the live portion of the demo, you will see that Alora does allow the clinician to indicate if the answer was nonsensical or refused, as well as incorrect, so we can identify when the interview should be stopped, and Alora will automatically score C0500 with a 99. Here are some examples. The assessing clinician asks the patient to state the year. The patient replies that it is 1935. How would you code this and why? This would be considered an incorrect response. It would not be marked as nonsensical because it does relate to the question at hand. Example 2, assessing clinician asks the patient to state the year. The patient says, "Oh, what difference does the year make when you're as old as I am?" The clinician asks the patient to try to name the year, and the patient shrugs. How would you expect that you could code that? What would the response be? The answer for this question should be coded as a refusal or a no answer in Alora, so this response will populate a 0 score for the incorrect on the Oasis E. This would not be considered a nonsensical response because the patient's statement is logical and clearly relates to the question. Example 3, assessing clinician asks the patient to name the day of the week. The patient says, "Blue, that's my favorite color." The clinician asks the patient the question again to confirm that the patient is not hearing the question correctly, and the patient answers with the same response. How would you code this one? Nonsensical. This is because the patient's comment clearly does not relate to the question at hand. I hope that is helpful to everyone. Test your staff's knowledge on how to answer the assessment questions based on the patient's responses. It's very important that they understand when a response is nonsensical versus incorrect. Another assessment for confusion assessment method, also referred to as CAM, has been included to help the clinician assess for signs and symptoms of delirium. The purpose here is to differentiate between dementia symptoms and delirium symptoms. Delirium often is related to an acute onset and can be relieved through treatment. An example of this would be a patient who presents with a UTI. They may present with symptoms of delirium, which may resolve when antibiotics are ordered and administered. The instruction provided by CMS is first for the clinician to observe the patient's behavior during the assessment, review the medical record, and consult with family and staff to determine if the baseline status compares to this current status. Consider all the relevant information and use clinical judgment to determine if there has been an acute change in mental status. Here is the indications for signs and symptoms of delirium. It does require the presence of all three items. Item A equals 1, or B, C, and D equal 2. Item B equals 1 or 2, and item C equals 1 or 2, or item D equals 1 or 2. Fun times, right? Section D is found in the neuro-emotional section of Alora. These elements are also completed on the start of care, resumption, and discharge assessments. Here are a few of the items inclusive. Section J is the sensory section in Alora. It's also completed on the start of care, resumption of care, and discharge. It relates to how the patient is affected, how the pain is affecting the patient's sleep, therapy, and their day-to-day activities. Section K, K0520, nutritional approaches, is included on the start of care, resumption of care, and discharge, and is determining the method of receiving nutrition. Section N, medication section, item N0415, is included for start of care, resumption of care, and discharge, and is looking for high-risk drug use and indications. Section O, found in the care management section of Alora. These items are completed on the start of care, resumption of care, and I'm sure you know by now, at discharge. That concludes the elements that are in Alora, the new elements. We have summarized the Oasis D items which were either removed or replaced in the Oasis D1 conversion to Oasis E. Items that are removed show on the right column with a NA, and if they are being replaced, then the new question is displaying in the right column. So you'll be able to look at that and know what the question is being changed to. As I mentioned, I am certain many clinicians are happy to see some elements being removed on the recertification. Here is a list of the items that are no longer part of the recert follow-up assessment. Please note that although diagnoses are not required on the export file for the recert, it is needed for the HIPS code calculation and is provided to the Alora user for that purpose. So you will see that in the recert. Now for the part you've all been waiting for, the live demo. I am going to turn it over to Terrence now and allow him to illustrate the solution in Alora. Terrence?
Thank you, Colleen. Hello, everyone. I'm back, and I'm excited to show you the Oasis changes Alora has made for Oasis E. I'll also be reviewing some items that clinicians may not be aware of in the assessment. I will be skipping pages with minimal or no changes. So let's get started. So let's travel into the future to January 12th, 2023. I have a scheduled visit for Oasis E. Let's take a look at the service description. All right, I have a PT start of care Oasis to perform. I'm ready to start my visit. It's very important that clinicians are paying attention to the MU90 date when adding an Oasis assessment. This date is going to determine which Oasis version to use. Any Oasis created with a MU90 date on or after the 1st of January 2023 will be created using Oasis E. Once you click OK, there's no way of changing the Oasis version. You will have to add a new assessment. So it defaults to the current date. And so if after the 1st you are late in adding an assessment for 2022, make sure you update this date to the date the assessment was actually completed. All right, so the first tab, the reason tab, we have a very simple change here. We did include the ability to attach the Oasis assessment to a scheduled visit. As most of you are probably aware, the Oasis will be linked to a scheduled visit anyway if initiated from the dashboard or from Care Connect. Let me go and create my start of care assessment as a PT. So if you are playing around with it, once it's released, you will probably get this warning message letting you know that they won't be able to validate the assessment until there's no more future dates. All right, the patient tracking tab. This is where we have our first set of new Oasis questions. We have A1005 for ethnicity and A1010 for race. These items replaced MU 140 for race ethnicity. These are multi-select items. We do have some logic as well to disable items if no is not selected. If the patient is unable to respond to these questions, you can use a proxy response or medical record documentation to help complete the assessment. At the bottom, we also have A1110 for language. So it is a text box where you're supposed to enter in the preferred language. I'm going to hit next. In the history and diagnosis section, the MU 1000 tab, what I wanted to show you here, just in case you weren't aware, we do have this button that says update from hospitalization log. So if your intake is putting in hospitalization dates, if the patient is coming from the hospital into the hospitalization log in the admission, then clicking this button would allow you to update that field with the discharge date entered in the hospitalization log. That way they're not having to search documentation for discharge dates from the hospital if they already received it upon intake. This tab also has the new Oasis question for A1250 for transportation. This is also a multiple selection option, and also a proxy response or medical record documentation could be used to help respond to this question. Supporting documentation, what we did on this tab was we included the homebound status comprehensive item to the same tab since they're all related, and we did reduce the amount of checkboxes so that we don't duplicate items that were selected under homebound status verification. And this is actually a really big change here once we get to the MU 1021 for the diagnoses. So all the ICD codes have been consolidated into one tab. So you have your MU diagnoses, you have your comorbidities, additional comorbidities, and you have your historical diagnosis. We did make it so that you can upload unlimited ICD codes. Once the MU diagnoses have been filled, you will have the option to add additional comorbidity codes. So let me go ahead and add some here so you can see what that interface looks like. What I wanted to show you here, in case you've never noticed, there is another column here for warning to let you know that this diagnosis code is not HIPAA compliant for electronic billing. I'm also going to add another diagnosis here as well. No, I already have that diagnosis. Oh, it's right there. So what I wanted to show you here was that the diagnosis codes would flow from either the MU questions to comorbidities or even to historical diagnoses. So if I wanted to move a diagnosis here into the MU section area, I could use the up-down arrows, which we had previously. If you have the last diagnosis code under comorbidities, will allow you to select down, and what that would do is actually move it into historical diagnoses. And vice versa, if you had a historical diagnosis like this coronavirus diagnosis here and it becomes active again, you can move it up. We did replace the star button with this up arrow. What this does is it makes this diagnosis code the primary diagnosis code. I'm going to jump over to the patient input tab. So what I just wanted to show you here, there's no changes to the questions, but There's going to be new formatting throughout. So what we did was we optimized the desktop version to be compatible for mobile devices as well. The communication tab, there's no changes here, but what I wanted to bring to your attention was that we did move it to the history and diagnosis section. It was previously under the sensory section. The vitals tab under living, what we did here was we put the known recent lab results together with the vital signs. Previously, this field was in the cardiac section. I'm also going to enter a height and weight in here for a surprise. And also down here we have MU 1100. We did change it from the table format to a checkbox format for user friendliness. I'm going to jump over to sensory. For those that didn't know about this shortcut as well, on the bottom right, there's this little gray up arrow that moves you straight to the top. All right, so in the B0200 tab, we have some more new Oasis questions. We have the B0200 for hearing. We also have B1000 for vision, which replaced MU 1200 for vision. And we also have B1300 for health literacy. The pain tab, we have some more additional Oasis questions here, or new Oasis questions. J0510 through J0530. These three items replaced MU 1033, frequency of pain interfering with patient's activity or movement. I'm going to jump over to our integumentary wound section. And what I wanted to show you here was that we did update the wound assessment to be more comprehensive and aligned with the improvements we've made on the SNAP note. So you'll see there's a lot more fields here to complete. If you've done one on a SNAP note, then you're probably familiar. We've also included the ability to add photos from your Oasis assessment as well. I'm going to jump over to cardiac. So all I wanted to show you here was based on the height and weight that I had entered previously under MU 1060, we do calculate a BMI score for you. Let me move over to nutritional status. Here we have our another new Oasis question, K520 for nutritional approaches. Now let's take a look at the BIMS assessment under the neuroemotional section of Alora. So we have already started applying the skip logic for these new Oasis questions. If I was to, for C0100, should the BIMS be conducted? If I select no, it does disable those questions as they should be skipped. If I select not assessed, then there's even a message here based on the selection. All of those items will be set as not assessed. So in order to conduct the interview, I do have to select yes here. And what I wanted to show you is if I was to select no answer or a combination of no answer nonsensical response for the first 4 questions, it does stop the interview, and there's even a message here based on the responses. CMS coding guidelines recommend that the BIMS interview be stopped and a value of 99 entered. So we do calculate that BIMS summary score for you as well. We also have the new Oasis question for C1310. Again, you probably want to refer to the PowerPoint slide, but in order to indicate that there may be delirium, there are 3 conditions that have to be met. A equaling 1 or B C or D equaling 2 plus item B being either 1 or 2 plus item C being 1 or 2 or D being 1 or 2. As Colleen said, fun times. The Moose 1700 tab, we have some more new Oasis questions available here, and that is the patient mood interview, PHQ-29. So as you see, it only does have the PHQ-2 items here. For each item, you're supposed to select a presence and then a frequency. Based on your responses for these items, for A and B, it will determine whether or not you need to complete the remaining questions for the PHQ. And one of the conditions are if the symptom frequency of either A or B is 2 or 3, then you're to complete the remaining PHQ interview. Here we also have the total severity score, which is calculated for you, and the D0700 for social isolation. Now what I wanted to show you, the PT documentation, and of course this would only be available if a PT was completing the Oasis assessment. What I wanted to show you here was that we did include the plan of care documentation into the assessment, so you don't have to create another document in Alora. All right, now I'm going to jump to the medications section. I did add a medication to my medication profile, so I'm just going to go ahead and sync with my med profile here. So what we did in the medications is we combined the medication profile together with the MOO questions, and that's to help you reference a response based on your medication profile. It's going to be exceptionally helpful, especially for the new Oasis question for N415, where you're assessing the high-risk drug classes. So as you can see here, on the medication profile, we do include the classification. So if there's any antipsychotics as we have here, you can indicate that they are taking that. This is also a new control. You'll see these little dashes. So if you recall from the other Oasis questions, a dash is indicative of a not assessed response. So if I select that, it does indicate that it was not assessed. So that's what those little dash buttons are for. We go over to the next tab. So remember that CMS does state that dashes should be rarely used. In the MOO 2102 tab in the care management section, we have another new Oasis question for 00110, special treatments, procedures, and programs. And we have that same control, which includes the dashes if it was not assessed. And there are some items here that are only available. They're sub-items for this main item. So if I do select that, then the sub-items become available for selection. I'm going to go over to the next tab. The MOO 2200 tab under therapy. What I wanted to show you here, we don't have any new Oasis questions on this page, but we did change the control for GG0100 and GG0130. So if you've been documenting the Oasis assessment on a mobile device, and you're probably going to be familiar with how this works. So basically, when you click in the box here, you're able to select the appropriate response. So those that like to avoid the mouse and like to tab to the next question, you could certainly do that as well. You can use the up and down arrows to update your responses as well. If I go to the next tab, you'll see that that same control was applied to GG0170. Again, I could just use my tab instead of the mouse. And that's actually all of the items that I was going to show you for the new Oasis E. I wanted to show you some additional items as well, though. Here we have our validations for missing items or incorrect responses. So what I wanted to show everyone as well, in case you're not familiar, in the Oasis export area, if you were to go to previous exports, it's going to list all of the Oasis batches you've created in the past. What you can do is when you select a batch and scroll to the bottom, there's another tab here for update acceptance status. So you can mark that they've either all been accepted or they've all been rejected, or you can individually mark them as being accepted or rejected as well. This helps you track whether or not only were they exported from Alora, but they were imported into the iKeys system, and someone reviewed that final report to make sure that they were all accepted.
And Terrence, this is not a new feature, but just something we wanted to bring to the attention, thought they might not realize that was there, right?
That's correct.
Thank you.
Of course. All right, so I'm going to go ahead and show you that we've already done the program to generate the Plan of Care Plus from the Oasis E assessment. I didn't complete any Plan of Care items for this patient, so I do have another patient here, Miss Medicare. So the functionality is still the same. Once you complete the assessment and you're ready to generate your Plan of Care, you can already have one created. Let me delete that. All right. And there hasn't been any changes to the Plan of Care Plus format, so I just wanted to show you that that functionality is available. Also, the QA Center, your Oasis E items will be available here as well. And you shouldn't have to worry about generating NOAs for your Oasis E patients. It's going to cause no problem. You can see that I have my January 2023 patients here. It's only checking that a visit was started or that an Oasis exists. And that's it for the live demo. I think we're ready to discuss some additional improvements that are in development regarding the Oasis E. The first item here is planned interventions carrying over to the SNAP note to make it easier for your caregivers to apply any preset planned interventions. And these can be set up in advance in your care plan template setup. And the planned interventions was previously only displaying when you're creating the Oasis assessment. We are going to allow carrying over of active care plan items from the plan of care to subsequent Oasis E assessments, such as your resumption, recert, and discharge assessments. This will help you to identify goals that have not been met and improve your discharge planning. The ability to generate a verbal order plus from a resumption of care Oasis assessment to update the plan of care post-hospitalization, and the ability to update the patient admission diagnosis tab based on the Oasis assessment. So lots of exciting improvements ahead. There's definitely a lot more improvements, but these are the ones that are currently actively with development.
Thank you all so much. Have a great day.
you.